Today's story is sponsored by Tidelands Health.
Good morning. Thanks so much for watching Living Local. Today I'm at Tidelands Health Cancer Center and I'm chatting with Dr. Adams. How are you?
Good. How are you?
I'm doing great. Thanks so much for joining us today.
Absolutely.
You know, it is October, which is Breast Cancer Awareness Month. So we have been diving in all month with Tidelands Health about kind of breast cancer awareness. So Dr. Adams, tell me kind of why this early detection is so important for folks.
Well, the sooner you catch a breast cancer, the more likely that breast cancer is going to be curable. So early detection is really important. You're also much less likely to have extensive surgery or chemotherapy if you catch a breast cancer early. Sometimes we have abnormal cells in our breast that could develop into cancer, but if caught early may not even require the same amount of treatment. And really just the earlier the better.
Yeah. Well, when we say early, how early is early?
Well, sometimes you can have abnormal cells in your breast that aren't even cancer yet, or that are just very, very small that you would never be able to feel on a breast exam. But with 3D tomography, which is a 3D type of mammogram that Tidelands Breast Center offers, you can catch these cancers very, very early.
Nice, nice.
But when you're doing a breast exam, I recommend doing this once a month. You can do it at the same time of the month when you're getting out of the shower and you just want to raise your arm on the side that you're going to examine in front of a mirror. You want to look and see, are there any skin changes to the breast? You want to see, are there any changes to the nipple? So if the nipple has become inverted, that's always a warning sign.
Oh, wow.
If there's any redness to the skin, that can sometimes be concerning for the development of a breast cancer. And obviously, if you palpate a mass, and that's what we're going to talk about with this model here today.
Okay. So tell me how this works.
So this is the nipple of the breast, and this is a model, and this is what we call the axillary tissue. So this is the tail of the breast that goes up towards under the arm. And whenever you want to examine your breast tissue, you just want to go in small circular motions and make sure that you cover all of the ground, okay? And so you want to make sure that you go deep enough so that if especially the larger your breast, the more deeply you want to feel to make sure that if there are any nodules or, again, small tumors that are up closer to the chest wall, that you get there and feel those as well.
Okay.
And then you also want to feel behind this area, which is called the nipple areolar complex, or the NAC. This is the whole area around the nipple, and you just feel back there. And this model has a couple of different areas where there are nodules that you can palpate.
So does this one have kind of, you know, masses in there that are considered cancerous?
Yes.
Yes?
Yes.
So I'm going to feel this. Where do I push?
So I would push right here, just kind of medium pressure.
Okay.
I'll put it down.
Oh my gosh, this is crazy. Oh, wow.
And these are gel models, and so normal breast tissue, real life breast tissue, doesn't feel exactly like this, but it certainly is a learning experience to feel that, and how subtle sometimes these nodules or tumors in a breast can be. And then feel over here on this side.
So I'm trying to almost describe what this feels like, because it's not what I would expect. It's softer. You know, in my head, I always thought it would be like this hard marble type thing. And it's really, you know, kind of a soft, you know, bulge in there. I don't know how to describe it, but it's not what I thought it would be.
And I think what you're saying is very helpful for the people who are watching. To understand that there is no one way for a breast cancer to feel on a breast exam. So if you have something that is a change, or that just doesn't feel the same to you, or you notice anything differently, it's always better to be safe than sorry. Always call your primary care doctor, and don't worry that what you're feeling could be just, you know, nothing to worry about. We can figure that out for you.
Well, folks, of course, again, we want to encourage you to get your yearly mammograms, and you guys can visit the information on your screen if you'd like to learn more or get in touch with Tidelands Health. Thanks so much for watching Living Local today, and thank you for joining us.
Thank you for coming here and seeing our breast center.
Absolutely. Stick with us. We'll be right back.
Today's story is sponsored by Tidelands Health.